Afternoon. My name is Sharon BOGAN from Public Health Seattle in King County. And today we are here with Executive Constantine from King County and our Health Officer for Public Health Seattle in King County, Jeff Duchin. Today we are marking the year anniversary since COVID-19 first hit our community. And so we're looking forward to having both Executive Constantine and Dr. Duchin share some reflections. So with that, we'll move right into hearing from Executive Constantine.
Well, thank you, Sharon, and thanks to everyone for being here today. This weekend does mark the 1-year anniversary since the COVID outbreak landed in King County. There are a lot of things to talk about, but mostly people are talking about getting back to normal and what the new normal looks like, about wearing masks and keeping your distance and video conferencing and remote learning, something that our household has learned plenty about. But 1 year ago, few could have imagined how much and for how long we would have to have everything turned upside down. We knew it was a serious disease. Dr. Duchin and his team warned us, and we took action, setting up our medical command center many weeks before the first confirmed case here in King County. When the tragedy at the Life Care Center in Kirkland unfolded, every county operation changed and adapted, and our community took unprecedented steps to save lives. And by our actions, by your actions, we did just that. We reached out to nursing homes and reduced the number of people in homeless shelters. We set up mobile testing teams. We distributed now more than 18 million masks in King County. We set up isolation and quarantine facilities across the region, and those have helped ensure that every person had a place to recover and to be separate from others they might infect if needed. And our rental assistant programs helped thousands of people stay in their homes, and they will continue to help folks who've struggled during this pandemic. Through all of it, my administration has relied on science and on guidance from our public health leadership to plot the course of our response. I know that the last year has been challenging for everyone, and we marked the loss of more than 500,000 Americans. Today, more than 1,300 families in King County are without their loved ones because of this virus. But today we also reflect on the struggles from the past year, and I want to put in context some of the work that has been done in response to this extraordinary moment in King County. Our data analysts within public health have been crunching the numbers on our case counts over the entirety of the pandemic, over the course of the last year, and across every metropolitan region in the country, and what they saw is significant. When you look at the 97 most populated regions in the country, King County is the 13th largest, as you can see from this chart. Because our community worked together, because we made sacrifices and took difficult steps, out of those 97 most populous regions, King County is the 96th in case count, 96th in the per capita number of infections, behind only Oahu County in Hawaii. That is astonishing success. Consider that we had no roadmap. Consider that we had very little help from our national government. Our success was not an accident. When the outbreak started, there was swift action, and that swift action helped make a dramatic impact on the spread of the virus. Those isolation and quarantine facilities helped thousands of people stay safe, and in turn prevented thousands and thousands of infections. Distributing millions of masks helped stop the spread. Businesses and schools moved so rapidly to working from home and to remote learning, and it all played a part in this remarkable achievement. Make no mistake, this virus has taken its toll on our community, and we will forever be changed by it. But as we approach the 1-year mark of this pandemic this weekend, the people of King County can know that everything you have done to help stop the spread of this virus has made an enormous difference. It is no exaggeration. It is not hyperbole to say that your work has saved the lives of friends and families and neighbors, thousands of lives across this county. And it was not just by these government actions. It was by people understanding their responsibility to one another and to making sacrifices that would protect the community that we have had among the lowest infection rates of anywhere in this country. As we look back, I think we should feel really positive about the progress we have made and that we are making. Our vaccination efforts are really just the beginning. And we already have we're approaching 500,000 people now. I think over 475,000 doses of the vaccine have been given out in King County. So that includes, within that number, people who've received one dose and people who've received both. Nearly 2/3 of the people who are currently eligible under the state guidelines have received at least one dose in King County. And we're excited about the increases to come from the federal government in the weeks and months ahead. Dr. Duchin will talk about those, but you think about how the first two vaccines rolled out a little bit slowly. The Biden administration has been working to increase their supply. Now we're hearing the positive news about Johnson & Johnson adding to the supply. It will still be frustratingly slow, but as you can see, we are making dramatic progress in getting everyone in the county who is eligible vaccinated. It will be many more weeks and months, but there is hope that we will reach that place that everyone talks about, which is community-wide or herd immunity. There are dangerous times between here and there, though. Dr. Duchin is going to talk more about some of the threats to our progress. Those come most notably in the form of these new variants that are arriving just this week in our county. They appear to be more infectious, and they are arriving at a time when people might be tempted to let down their guard. I would counsel everyone, please maintain the vigilance you have maintained over the course of the last year that has allowed us to achieve these remarkable results relative to almost every other place in the United States, and we will get through this together. See, the good news is we know how to slow down this terrible disease. We know how even to slow down its mutations, these variants that are arriving from around the world. It's the same thing you've already learned to do. Wear a mask. Avoid indoor gatherings, particularly with people who are not part of your household. So limit the time you spend with others who might infect you or whom you might infect. Maintain that social distancing. All of the rules that we've all internalized are maybe even more important now. And on this anniversary, we look back at this just astonishing year and have every reason to be optimistic about our future. People of King County should be very proud of what you've accomplished, of the work you've done together to save lives. Each of us has made a tremendous difference in slowing the spread of this disease. And let us simply resolve to maintain this until we have wrestled this thing to the ground and we can really resume living the lives we have all enjoyed and making the progress we want to make as a community. I thank you so much for everything you've done and particularly for being here today.
Thank you so much, Executive Constantine. Dr. Duchin.
Thank you, Sharon, and thank you, Executive Constantine, for your comments and for your ongoing and very much appreciated essential support of our public health response. 1 year ago, Sunday, King County became ground zero for an emerging pandemic due to a new respiratory virus, SARS-CoV-2, that swept us up into a storm of suffering and uncertainty that continues to buffet us physically, emotionally, socially, and economically. The COVID-19 pandemic has been an exhausting and ongoing year-long natural disaster, unprecedented in its duration, damage, and pervasive impact on our lives. In King County, we've had almost 82,000 cases and over 5,000 hospitalizations, and have lost close to 1,400 lives. So I will begin by expressing sincere condolences to everyone who's lost a family member, a loved one, or a friend to COVID-19, and to everyone who is ill or has been ill or is caring for someone with COVID-19. I continue to grieve with you, as do all of us at Public Health. It's been a terribly difficult year in many ways, and more difficult for some than for others. It's important to acknowledge that COVID-19 has starkly highlighted and exacerbated structural inequities and resulting health disparities in our society. Communities of color experiencing long-standing poor health outcomes from the effects of racism, from social, economic, and environmental disadvantage, and from lack of access to healthcare have been hardest hit by COVID-19, with higher rates of cases, hospitalizations, and deaths, while at the same time making up a large portion of the frontline essential workers that have kept our society functioning. I want to acknowledge the many, many people across King County of all ages, including children, who have suffered from the economic and other unintended impacts of this ongoing outbreak and its control measures. But today, despite the fact that our situation remains precarious and with significant uncertainty, the light at the end of the tunnel is getting brighter and the path to a more normal life is becoming clearer. I'll share a brief update of where we are in our outbreak and why, despite the uncertainty and the real and significant challenges that remain, I think there is cause for cautious optimism. And as you heard from Executive Constantine, we have many reasons to be encouraged as a community. Although this has been a dreadful year in many ways, King County and our region has, until this point, weathered the storm relatively well compared to most of the rest of the country. And as the executive has shown, King County has among the very lowest COVID-19 case and death rates among the 100 largest counties in the US, ranking second from the lowest in our total COVID-19 case rate and sixth from the bottom in our COVID-19 death rate. Even with this relative success, however, 21 King County residents lost their lives to COVID-19 last week. That's one death every 8 hours. An unacceptable statistic, yet one that's improved from December when a King County resident was dying from COVID-19 every 3 hours. Approximately 70 King County residents are hospitalized per week currently. That's a hospitalization every 2.5 hours. And that's down from one hospitalization every 40 minutes in mid-December. Our early outbreak first recognized that Life Care of Kirkland hit King County's long-term care facilities hard. And since then, almost 60% of all of our deaths have been associated with long-term care facilities. And as recently as December and January, hundreds of cases and multiple deaths were reported from long-term care facilities weekly. Overall, 85% of our total deaths in the county have been in people 65 years of age and older. So it's especially gratifying for me today to share that last week was the first week since the outbreak began a year ago that we did not have a single new case of COVID-19 reported from a long-term care facility. This is tremendous news. And as of today, our outbreak is about 90% of the way back to the level of COVID-19 transmission we were at before our most recent third wave, which was our largest yet, responsible for 3/4 of our total cases and 1/2 of our hospitalizations and deaths. Although we've been heading in the right direction on several fronts recently, we currently have 140 new cases reported each week, which is about twice the level we were at before the recent surge and 3 times the level we were at before the summertime second wave surge. This means there are still thousands of people with infectious COVID-19 in King County each day, up to half of whom can spread the infection despite showing no symptoms. A major concern for us is the more contagious and potentially more severe SARS-CoV-2 variants increasing locally and nationally, which pose a serious and unpredictable threat to our progress. Our current level of COVID-19 and the presence of variants of concern means we must continue rigorous COVID-19 prevention and precautions in order to avoid a potentially larger fourth wave of infections. It's critical to understand that we remain vulnerable, and complacency now would be a major mistake. But we are in a much better place today than we were a month ago, and we're heading closer to a possible return towards normalcy in a few months. The only question is, what road will we take to get there? On the positive side, we've shown we can drive COVID-19 cases down by changing our behaviors in our environment, limiting activities with people from outside the home, wearing well-made and well-fitting face masks, avoiding spending time in crowded and poorly ventilated indoor spaces, and providing resources to allow people to take necessary precautions. Continuing to pay special attention to decreasing risk in crowded and indoor poorly ventilated spaces by improving air quality indoors will be important. But the best news of all for ultimately controlling the COVID-19 pandemic is the development and increasing availability of highly effective vaccines, and we're continuing to vaccinate as quickly as we can get doses. We now have over 327,000, or approximately 1 in 6 King County adults who have received 1 dose, and over 166,000, or 1 in 11, who are fully vaccinated. Over half of our adults over 65 and older, and almost 60% of adults 70 and older have received at least 1 dose. Vaccination is our most powerful single weapon against COVID-19, but at the moment, it can't be our only strategy. It's essential to continue to decrease transmission through COVID-19 prevention measures and vaccination in order to reduce the risk for a major spring surge. If we relax too soon and fail to further suppress the spread of COVID-19, if we travel and gather to the degree we did during the summer and the winter holiday seasons, we will increase the risk of experiencing another large surge in cases, hospitalizations, and deaths this spring. So, although the trajectory of our outbreak is impossible to predict with confidence, especially with the new variants, it is possible that with clear-eyed, realistic optimism and a few more weeks of serious effort, caution, and vigilance, we may be able to put the worst of the COVID-19 pandemic behind us and return our attention to healing, recovery, and a much more enjoyable future. In closing, I want to acknowledge the difficult work that so many of our community members have done and will need to continue to do to help contain this virus and keep one another healthy in the coming weeks and months. I especially want to recognize our healthcare workers and first responders and the many other frontline essential workers who day in and day out since the very first day of this pandemic, under stressful circumstances and in the face of personal risk and uncertainty, have been providing healthcare and other essential services that our community depends on. And finally, I want to express my deep gratitude to each of my hundreds of amazing colleagues at Public Health, Seattle and King County, who have been going all out for over a year now, responding to this outbreak on behalf of all of us. Thank you, and I'll turn it back to Sharon to moderate.
Thank you very much, Dr. Duchin and Executive Constantine. Now we have some time to take some questions from media. You can use the raise your hand function and I will unmute you. Let's start with Steve McCarn. You are unmuted.
Hi, thanks for taking the question. Dr. Duchin, I just wanted to ask you your thoughts on the FDA Advisory Committee voting to recommend the Johnson & Johnson vaccine for emergency use today. I know that happened about an hour ago. There's still a couple more steps, obviously, before those doses can start getting shipped across the country, including tens of thousands to Washington. But what does this mean? And what type of step is this now?
Thank you for the question. This is more great news. The advisory committee approved emergency use authorization of another highly effective vaccine. This Johnson & Johnson vaccine is a little bit different from the existing mRNA vaccines. It does not require stringent cold storage. It can be used at standard refrigerator temperatures, and it is a one-dose vaccine, and it is 85% effective in preventing severe disease. So I am thrilled to have another highly effective vaccine in our armamentarium. It will mean more doses available to more people more quickly. The Advisory Committee on Immunization Practices will be meeting Sunday and Monday to review the evidence on safety and effectiveness, very similar to how the FDA reviewed the evidence, and then they will make recommendations on how this vaccine should be used in the US, and after that, that vaccine should ship. Now, it's important to understand that there's limited supplies of this vaccine currently, a couple of million doses. The exact number keeps changing in the press reports, but it's not going to be for several months until there are large quantities of this vaccine available. But it is very, very good news, and I'm very happy about it.
Great. And if our news media can also tell us what news agency they are reporting from, that will also be helpful. Anna Boyko-Wyrock, you are unmuted.
Hi there. Thanks so much for taking my question. I'm with KUOW Public Radio. So just reflecting back on the last year, we've learned a lot about the virus. And I just want to play you a 12-second clip, Dr. Duchin, of an interview that you gave to one of my colleagues around this time last year. And I'm just curious to hear what you think now in hindsight.
There's no good evidence that mask use for the general public makes a difference, and there's some evidence that it might increase your risk of getting sick because those masks can get contaminated and you can touch them with your hands and then touch your face.
Thanks for playing that clip, Anna. That is a great illustration of the evolution of knowledge around a new emerging pathogen. And I am increasingly impressed by the fact that this virus, in fact, is transmitted primarily through the air, through airborne or aerosols. And at the time when this virus was recognized, we were relying on what we knew about the SARS coronavirus, the MERS coronavirus, for which mask use was not recommended, and even currently is not recommended for people who don't have symptoms, which would be the general public. That was the topic of that particular quote. But I'm very just amazed at the speed with which we've learned more about this disease. Another important fact that we didn't know at that time, which led to that conclusion, was that this virus can spread from people before symptoms develop through the air, through the many particles that are emitted just through speaking, can remain airborne and spread the virus. So we learned a lot about how SARS coronavirus 2 is transmitted over the course of this year. We're continuing to learn a lot. I don't have any illusions about knowing all that we need to know about this virus. I am confident, and I think one of the other things that I said initially was we were going to make a lot of mistakes going forward with an unknown pathogen. As we learn more, we'll adjust our guidance and our advice and improve our knowledge. And that is still going to continue to happen. And I think particularly in the area of treatment. But yeah, thanks for reminding me of that moment.
Great, thank you. Kayla Lafferty, you can go ahead.
Hi, thanks so much for taking my question. Kayla Lafferty with King 5 News. First off, can you just talk about if, the FDA really does go forward with this emergency use authorization of the Johnson & Johnson vaccine, how that will kind of change things for King County. And then also another quick question, the FDA changed the guidance for the Pfizer vaccine yesterday and now doesn't need those ultra cold freezers while undiluted for up to 2 weeks. Will this change how the Pfizer vaccine is distributed in King County, or how overall does this impact the county's vaccine plan?
Yes, both of these bits of news, the fact that the Pfizer vaccine can be stored outside of ultra cold storage, and the addition of a new vaccine that can be stored at refrigerator temperatures will increase the number of providers who can administer COVID-19 vaccines. So it's really just a question of supply again. Once the supply increases, there'll be more people who can use these vaccines, which will be a very good thing for everyone in our community and in our nation.
Thank you. Jessamine McIntyre, you are unmuted.
Hi, thank you, Dr. Duchin. Jessamine McIntyre, Q13 Fox. Given the influx that you are hoping to have reported just over 69,000 doses coming in for Johnson & Johnson next week, if and when it is approved, which communities do you think it could affect the most? And also, if you could tell people who might have hesitancy seeing the 66% efficacy rate, why they should take it.
Sure. Yeah, a couple of things to understand. First of all, the Johnson & Johnson vaccine was tested in a different time and in a different place than the mRNA vaccines. So it's really not possible to compare them head to head. They also use different definitions for the types of disease that they're preventing, slightly different. So it makes it very difficult. On the other hand, we can say with confidence that all of these vaccines are highly effective in preventing what's most important, severe disease and hospitalization. The J&J vaccine in their trial, which included patients from the US, from South Africa, and from South America, protected against severe disease and hospitalization with 85% vaccine effectiveness. That's extraordinary. There were no hospitalizations and no deaths among anyone who received vaccine in their trials. This is a very good vaccine. It's a one-dose vaccine, which is very attractive. It has fewer adverse effects, less of those reactions such as fever and redness and so on, less pain than some of the mRNA vaccine side effects. So there are some very attractive features of the vaccine. Single dose, very easy to store compared to the mRNA vaccines, highly effective, and potentially fewer side effects. So I think those are all very strong reasons to get vaccinated. In addition, like all of our vaccines, the manufacturers are continuing to study them. And it's possible that a second dose of this vaccine will bring the effectiveness level up even further, which would be comparable to what was seen with the mRNA vaccines. However, again, it's really not possible to make a direct comparison. What I would say to folks is, if you prefer to have one dose, that's a clear reason to prefer this vaccine. However, the real advice is, if there's a vaccine available to you, you should take it. There's not necessarily going to be the ability to choose and move from one vaccine provider to the next based on the particular product they're using. We can say with high confidence that all of these vaccines protect to a very high degree against severe illness, hospitalization, and death.
I was just wondering about the first part of my question of which communities you think that it could impact the most?
It's hard to say at this point who it could impact the most. The guidance for how to use this vaccine will be issued maybe Monday or Tuesday by the Advisory Committee on Immunization Practices. So that's the first step, is to see for whom the recommendation is made, what populations, if they recommend any particular prioritization or groups for whom this vaccine might be more preferable. And then once those guidelines are made, states and locals and vaccine administrators will consider how best to use it in their communities. Certainly people who wouldn't want to or wouldn't be able to comply with a 2-dose regimen would benefit greatly from a single dose authorized vaccine.
And if I could just add, we're continuing to emphasize the public health role in filling the gaps in the rest of the system. So part of our job, whether it's with the Pfizer, Moderna, or J&J vaccine, is to make sure that there is availability of the vaccine and real, genuine access for people to make appointments in communities that have been more impacted by infection and have had less access to the vaccine. That may be geographic because of where medical facilities and other traditional systems are located, or it may be economic, or it may be racial and ethnic. We are looking to make sure that all of this vaccine is provided in a way that is equitable, and that we are, regardless of where you are in the community and in the society, making sure that the people who need it most can get it first. And I think that King County Public Health, led by Dr. Duchin and Director Patty Hayes, have been very focused on that and have shown really strong results in making up for the sort of inherent inequities in the pre-existing systems.
Just have a question from a community asking about or sharing that it's such positive news that we have done so well relative to other parts in the community in America. But wondering, given that context, why we don't have more schools that are in session and open. And any comments on that, maybe starting with you, Executive Constantine?
Sure. Every school district is having to approach this in some ways on their own, working with their own employees and with the parents and students. I know that the governor is very focused on helping school districts figure out how they can get reopened, even if it is only first for those students with special needs or for the very youngest students, one of whom you may hear in the background as I'm trying to answer questions. My first grader has been out of school and being schooled at home for almost a full year now, and I know the strains put on our family, so I'm very aware of what the strain may be putting on others who may be less privileged. It is now becoming clear that some school districts are able to partially open. I know the governor is continuing to work to figure out what it is those districts and their teachers and other staff are going to need in order to be able to get back into the classroom. I'm very anxious for it to happen myself. And I have every confidence, and this is not a public health opinion, Dr. Duchin, this is a political opinion and the opinion of an observer, that we will be able to be back in full force in the fall once we're able to get vaccines to the vast majority of adults in our community, including all the teachers.
Dr. Duchin, is there anything else you wanted to add, particularly on schools and from a public health perspective?
Well, I would say this, the issue of in-person learning has been one of the more challenging aspects of this pandemic from the get-go. Initially there were issues around timing and closure of schools and whether that should be done or shouldn't be done. And across the country, many schools, I would say most schools, closed inevitably due to the uncertainty and the severity of this this outbreak, nationally. And when you ask about King County being relatively well off with respect to cases and deaths, that's absolutely true. But it's also important to remember that we had a severe outbreak, and we're still having a very significant outbreak. So we know that this virus transmits where people come together, particularly in closed indoor air spaces. There need to be significant precautions in place, in order to get back to school safely. But with those precautions, I think the consensus nationally is that it can be done. And the decision about when a school comes back to in-person learning really is one that has to weigh the risks of children being out of school, and the benefits of in-school learning with the risks of transmission once in-person learning reconvenes. And there will be COVID-19 in our community for years to come, if not indefinitely. There will be the risk of introduction of COVID-19 into every environment, including schools. The question is how to minimize that risk to the greatest extent possible so that the school administration, the teachers, the families are comfortable with getting back to in-person learning. We have increasingly good and detailed guidance on how to make that happen. And I'm also optimistic, as is the executive, that over the next few months, particularly if we get over this next springtime threat period due to potential rebound outbreak from the variants, once we get over that and we have more people vaccinated, we'll see a lot of in-school learning happening much more rapidly.
Yeah, Dr. Duchin, I'm doing a story about the incredible numbers that we're seeing in terms of the nursing home deaths, and it's so amazing to hear that there weren't any in the last week for the first time. I was looking at some of the CDC data about this, and I know that nationwide the trend in deaths is dropping dramatically, in part because, or largely because of the vaccination rates. But I see that in, I don't know if you have an answer for this, but I see that in February, on the 14th, for the state at least, it was going up in early February before it started dropping after mid-February in Washington State for nursing home residents. And I'm talking about the death rates. And do you have any insight on why that was, why that went up here before it started to go back down in February?
Well, I can't tell you with certainty, but there are a couple of potential explanations. I mean, you have to think about the timing of when people might have been infected and then the time when they might die. So there's quite a lag there. So deaths always lag infections, but typically by several weeks. Secondly, the timing of the vaccination programs and how it was rolled out and how it reached various long-term care facilities was quite variable across the state. So that may also play a role in the timing of any impacts that you'll see from that vaccination program. Our large third wave peaked in early January. And we had cases starting to decline at that point, and then several weeks later, hospitalizations and deaths followed. And so you'll always see that delay. Part of the downturn in deaths in long-term care facilities may be attributed to the general decrease in transmission in the community. But I think as we go forward and separate out in time from when our outbreak took a downturn and when the vaccination program achieved high level coverage in those nursing homes, we're going to see more and more effective vaccination. And as has been shown in other countries, particularly in Israel, very dramatic decrease in deaths in older adults. So it's so heartening because, as I said, 85% of our deaths have been in older adults. And that's why we're focusing on older adults as in the early phases of our vaccination program. And it's just so gratifying to see those death rate numbers dropping as more and more are protected. And, we'll continue to expand vaccination and its benefits out to other age groups and other risk groups. But we're going to see a marked benefit from vaccinating our oldest adults increasing in the coming weeks.
Thank you. And Deborah Horn was able to put her question in the chat. It's related to what you said about the Johnson & Johnson vaccine. This is for Dr. Duchin. Are you concerned about the efficacy of the vaccine will make some feel that they're not getting the best vaccine? I think you addressed this a little bit, and what we can do to counter that. And maybe just more broadly, I know that we hear across the community that people have questions about the vaccine. And so what are some of the ways that people can continue to get information and get their questions answered? I think all of us have quite a few questions.
Mm-hmm. Yeah, So there are a few sources of information that I would recommend to people. And again, there'll be more after the CDC's Advisory Committee on Immunization Practices reviews the data and makes recommendations on how to use this vaccine. I think CDC is an excellent source, but this information will not be available for the next, for at least a few more days on their website. There are good sources of information about the type of vaccine, an adenovirus vector vaccine that I've seen in, for example, the New York Times, that has a very nice feature online about all the different vaccines and their methods of working and how they create an immune response and how they're made. But the bottom line, the real important information I think for people is, is it safe and is it effective? And based on what I saw today and what the FDA's Expert Advisory Committee concluded, it's safe and it's very effective. And again, we really can't compare our 3 vaccines. They were tested in different populations at different times. For example, this Johnson & Johnson vaccine, the single shot, which has advantages because it's a single shot, which the others don't have, was tested in countries which had a lot of variant virus circulating. And we know that those viruses can be harder for vaccines to protect against, yet the mRNA vaccines were tested at a time when those variants were not circulating. So again, it's hard to know what the numbers would be for the mRNA vaccines if they were tested at the same time and then in the same population as the J&J. So again, it's just not scientifically valid to compare the vaccines under such different circumstances. We can say with high level of confidence, they're all very effective vaccines, and they're extremely effective in preventing the outcomes that we care most about: serious illness, hospitalization, and death.
Thanks. We'll try and get in one more question. Anna Boyko-Wyrek, you had a follow-up to your question.
I can't wait.
Oh, so actually on a different topic, I guess thinking back to last year, there were dozens of confirmed COVID cases, but really there were probably many thousands in the state, right, at the time. And so now here we are a year later, variants, and we have a handful of reported variants. Are we in the same situation? How much more prevalent are the variants than what we're finding, given just the small percentage that we're actually able to catch and look for? And can we tell how quickly they're spreading in the county right now?
Absolutely. Thank you. As I mentioned in my comments, we have about 140 cases or so being reported every day, but in actuality, there are thousands of people in King County every day who have infectious COVID-19. So the reported cases represent, the tip of the iceberg. They represent a portion of those cases that are really having their onset on that day, because many are mild, don't get tested, asymptomatic, don't get tested. And then there are cases that were diagnosed previously but remain infectious. So if you want to think about risk, you think about prevalence and how many people actually have infectious virus out there in the community. So for COVID overall, we're estimating that there, maybe you would say 5,000 or so people with infectious virus in the county at this time, ballpark. With respect to the variants, we have very little data on which to base estimates. For the B117, the numbers are increasing over time, but we're only testing still a very small proportion, less than 5%, probably just a few percent of all the COVID tests get sequenced to understand if there's a variant or not. So it's quite possible, and I think even likely, that the variants are much more prevalent than our limited surveillance data has told us. And that is why we're continuing to emphasize the critical importance of suppressing COVID-19 transmission to the greatest extent possible using what we know works. Limiting activities, face mask use, despite what I said a year ago, face mask use, and a well-made and well-fitting face mask will protect you. We know that now with much certainty. Understanding that this virus spreads through the air and particularly in enclosed indoor air spaces, and continuing to use good hand hygiene. These strategies will prevent transmission of COVID-19 variants, regardless of when they appear and where they appear. The variants spread more quickly, and they may cause more severe disease, and some of them may be more resistant to the vaccine-induced protection. However, as long as we keep our overall numbers down, the impact of those variants will remain relatively low. The problem we'll get into is if we let COVID transmission, if we let up on our COVID prevention measures and we let COVID transmission accelerate again, and we let these variants that spread more quickly gain momentum, they can quickly start to multiply and increase and lead to another wave of infections this spring, and that would be unfortunate and potentially stressful. It's impossible to predict, how high a fourth wave might be, but there clearly are enough variants circulating here and also in the country as a whole, particularly of B.1.1.7, to make that a real possibility that we can't ignore and must take seriously.
Thank you. And with that, I think we will get ready to wrap up. Any final thoughts from you, Dr. Duchin, and then Executive Constantine?
Well, I also just want to say thank you to everyone in the community that's been working so hard to help us, to help one another manage this long-standing outbreak, to grapple with all the uncertainty and the impact on us as individuals and as a community. We are getting close to putting this in the rearview mirror, and I think the next couple of weeks to months will really chart our course with respect to how successfully we're going to finish this. And so please don't let up now. You've done a great job. Hang in there. Continue to take COVID-19 prevention seriously. And I think together we'll be looking at a much brighter scenario in the summer.
Thank you. Executive Constantine.
Well, thank you. I want to start by thanking Dr. Duchin. Jeff has provided us very sound advice throughout this. Yes, the understanding of this disease has evolved over time, and our understanding of our ability to react to it has evolved, and he has continued to provide us sound guidance based in science, based in medicine, but with a clear understanding of the context in which we are making these choices. And he and Patty Hayes, our public health director, have contributed tremendously toward the thousands of lives that have been saved here in King County. But really, the people who should be credited with that are the people of King County. There are many places in this country where people ignored public health advice, where they were getting conflicting messages from their leaders, where they either let down their guard or willfully chose to do things that they were being told were dangerous. And the result of that was more infections and more people dying. Here, that did not happen. Here, people understood their responsibility to the community, and here they made the sacrifices that ultimately ended up saving many, many lives. The thing I would encourage now is that we not let up. We know that there is a light at the end of the tunnel. We're all racing toward it, but we have to run and run right through that tape at the finish line. We cannot start waving at the crowd and preparing for our victory lap before the win is secured. And I think that with the vaccine supply increasing, with us increasing the ability to get the vaccines out quickly and equitably, all we need now is for people to continue to be vigilant about wearing a mask, about not being cooped up with folks who are not part of their household, about doing all the things that have gotten us this far as safely as we have been able to get here. And we will be able to build out of this more quickly, more successfully, put more people back to work, and really be a success story to be able to tell the rest of the country and show a roadmap should this, heaven forbid, happen again. I'm tremendously grateful to everyone who has gotten us this far. Let's keep up the good work and fight this right to the end. Thank you so much.